Good afternoon to everyone and welcome to today's session. What is the structure which is labeled in the chest radiograph? It is the horizontal fissure. If you take left lung versus right lung, only right lung has got the horizontal fissure. Now regarding horizontal fissure, what is a statement which is not a true statement? It is also called the minor fissure. It's unilateral only on the right side and it is absent in about 3 to 50%, and it is at the level of the fourth rib is what you need to know, the anatomical landmark. Some of you are going to be top pulmonologists doing bronchoscopy every day. So before we give you the MD seat, you must be sure the one labeled was the lingular segment, which is the part of the left lung. The one which is being shown is the posterior basal segment, which is a part of the left lower lobe. Then the one which is shown is the cardiac segment. It is also called as the medial basal segment and it is the part of the right lung is what need to be remembered. Now this colored structure which is being shown is typically a hemidiaphragm. Always you should see the level of the two hemidiaphragms. Any unilateral elevation of the hemidiaphragm on the right side means there is a subdiaphragmatic pathology like liver abscess, or there can be a supradiaphragmatic pathology like atelectasis of lung. So that's the reason you need to be doubly sure. Now the one which is being shown, what is the pathological significance of the structure which is being labeled? So it is the costophrenic angle. It is significant in cases whenever the fluid collection is there. Early stages of the pleural effusion, it is the blunting of this area is very common. Now what is this diagnostic technique which is being shown called as simplest question? It's a X-ray bronchography, but in the modern era of CT, MRI, virtual colonoscopy, and there is something called as fMRI sequence. Whenever you are thinking, what you are thinking can be known based on the changes that happen in the chemical structure in the brain. fMRI sequences. So what is the structure that is enlarged in this whenever there is any ASD? So pulmonary trunk, ASD will bring a lot of left-sided blood to walk into right side, and all that right atrial excessive blood passes to right ventricle and into the pulmonary artery, leading to the enlargement of the pulmonary trunk. Now enlarged pulmonary trunk, as what you can see here on the chest radiograph, which view is that gives the best appearance of the enlarged pulmonary trunk? It is the lordotic view. The view which you see is called as the lordotic view, which is the most prominent one, is what you need to basically remember. Now in this diagram of the hypothetical cell, the cell membrane, if at all, is only permeable to sodium ions, what is the membrane potential? So it's a simple Nernst equation which you have to be sure. If you do the calculations, the value comes to 61 millivolts. Now what is the blocker, potassium blocker among this? It is the tetraethyl ammonium which is considered to be the potassium blocker. Now what does this diagram basically depict? It is a ligand gated channel. It remains closed or open until the neurotransmitter binds. So we put all these videos free in the YouTube. Somebody was commenting, sir, you have to explain a lot taking the pen and paper instead of quickly running through the questions. But the point is you have to solve the question paper on the uMedico. Download the uMedico app, subscribe for the mock test series, solve the question paper. Already you exercised your mind on it. Somewhere a small step you missed if you did it wrong. My job of discussion is to show you that small step and move forward. Otherwise, it is impossible to cover 100, 200 questions. Now, the label part A represents what type of transport? The one which you are seeing here, which is responsible for this type of transport. So, the transport of the molecules in vesicles along the microtubule that is being shown in the image, which is being given to you in the test, that is basically controlled and mediated by kinesin, by anterograde transport, is what you have to basically appreciate. Now, what is this called as? Basically, whenever the contraction of the muscle and the movement are happening in the same direction, it is basically called concentric contraction. It is moving in and even the muscle is contracting in the same direction as the movement is happening. It is called concentric contraction. Now, what is the typical forces that are acting, that are moving the molecules across the arterial and venous side? They are basically called the Starling Forces. Now, what is that neuromuscular blocker D? The one which is being shown as D fundamentally. So, it is succinylcholine and carbamylcholine. They are the depolarizing blockers which prolong the activity, because they have got a long activity, because they do not undergo any hydrolysis by acetylcholinesterase, is what you need to be remembered. What type of nerve injury this is? Basically one of the favorite questions in the NEET PG. So it is entire neuron got cut, that's the reason it is a neurotmesis, is what you have to basically remember. Now, what are those labeled parts from A to C typically? Another very typical NEET PG question. So, it is actin, tropomyosin and troponin in that order where they are being labeled. This is a sarcomere. What are these label parts? A, B and C basically. Very simple. Z-line, actin and myosin are the ones which are being shown. This label part A is calcium channel. So, what is it most likely to be? It should be a dihydropyridine receptor which is responsible for the calcium transportation. It is the calcium pump, is what you have to recognize. Now, in this length tension relationship, this what is this B? Typically the length is maximum, length at maximum cross bridge overlap is the point at which this graph is taking up. So that is basically called passive tension, which will arise from the resistive stretch of the titin and collagen, which is depicted in that graph of where the tension is increasing. I mean the graph which is depicting the tension arising after the maximum crossover between the actin myosin cross bridges happened. So that is basically the passive tension that arises because of the stretch that comes from titin and collagen. Then what is this neuromuscular junction receptor? Basically what is a neurotransmitter, doctor? It is the nicotinic receptor with acetylcholine. Definitely this question will once more, same ditto will come. Now what is this? Where the preganglionic neurons and postganglionic neurons are basically having in parasympathetic system. Acetylcholine is both pre and post synaptic terminals in the parasympathetic system. What is this? In the sympathetic nervous system where you have preganglionic and postganglionic receptors. So sympathetic preganglionic transmitter is acetylcholine and norepinephrine at the postganglionic for smooth muscle is what you have to understand. Where do you do string test, doctor? Microbiology questions are very easy. Vibrio. Gram stain smear with thumbprint appearance. Where do you have? Pertussis. Actually this microbiology MCQ setter was not very good at setting questions. Images were not, you should create a quiz within the image. That some teachers fail, I don't know why. A lot of teachers fail in setting questions. This is good, at least. This is a meaningful question, good question set. What stage of syphilis where you find the mucocutaneous lesions? Secondary syphilis is the time where you have mucocutaneous lesions. Coinocytic hyphae, as what you can see here. Where do you see? Typically in Aspergillus, you find coinocytic and aseptate hyphae. Then scalded skin syndrome is caused by which one? Staphylococcus aureus. Preventable blindness is due to trachoma. Then cat scratch disease is caused by Bartonella Huxley. McConkey is an example of a differential medium which will allow the growth of more than one organism which is of interest for you but not others. And if you want to distinguish that particular organism from morphologically indistinguishable other organisms, the best way is to use this differential medium. What is this method of sterilization called as? It is called the red hot method. Slide agglutination test is used basically for Salmonella, Vibrio cholera, Shigella. You use group specific and species specific organisms. They can be tested by using the slide agglutination test is what need to be basically remembered. Suckling mice is used for the isolation of, typically we use it for the isolation of Coxsackie virus. Segmented genome, as what you can see, they should only ask this kind of genome, where do you see? Then that becomes a top question. If you already say segmented genome and show a picture, that is not the kind of question. But okay, there are a lot of, we get from lot of sources, the image based MCQ. Some teachers are good setters, some are not good, but we will have different mix of questions. So it is typically influenza virus. Now what is this virus which is used as a vector for the vaccine preparation? It is the adenovirus. However, mycoplasma is different from the other prokaryotes. They don't have a cell wall. Now most of these culture media below are in solid state. Then what is the substance used in this media? So it is agar which is used as a solidifying agent. Agar is the most preferred one. At least this is a good question. What is the type of hemolysis is this? Is it a partial or is it a full? What kind of hemolysis it is? It is a bead hemolysis with a clear zone of hemolysis is being shown. So where do you see these budding yeast cells? So they are the gram-positive budding like yeast cells which are seen in the case of the Candida is what you need to appreciate. Now what is the third phase in the PCR reaction? What does it involve? So that is the time where the detection of the amplification products are being done in the third phase. After the amplification is being done, you need to detect them. You should not use the word racket. Simply you should say hyphae. Hyphae, this kind of hyphae. Where do you see? So typically they are seeing macroconidia or club or clavid shaped are typically seen in E. flocosum is what you need to remember. There is a spaghetti meatball appearance which is fundamentally the tinea versicolor caused by Malassezia furfur is what you need to ultimately understand. A 31-year-old woman happened to have this fracture of humerus. Fracture of humerus lead to injury to radial nerve lead to development of the wrist drop. That's what you need to align with. 85-year-old is being brought with episode of feculent emesis with a 3-day history of abdominal pain and nausea, and he has an abdomen which is distended and tympanitic, and the radiograph, the CT is being shown. So basically medical and supportive care only. This man did not express any consent what has to be done with his life. he is living in an assisted living facility. So the most important thing is, whenever someone is critically ill, they have no living will or designated power of attorney. The decisions about the healthcare fall into the hands of their closest living relatives. It's a very challenging situation sometimes when the life becomes completely minuscule quality of life, like Glasgow Coma Scale 4 or 5. Heart will be beating, lungs are blowing, but the man, the grandpa, already has passed away at the higher mental function level. What is the use of doing dramatic things, pulling out of the life and then putting a tracheostomy and doing until he becomes a food for bacteria, sepsis? There is no point. So in some countries, euthanasia, mercy killing, is legal. In some cases they did not say whether legal or not legal, and there are countries where it is not legal. So 56-year-old in intensive care unit had an open gastric bypass operation, and post-operatively he feels that his heart is racing and the temperature is 36.7, and what do you see? There is no P wave seen. So typically lack of P wave is atrial fibrillation. So how do you want to manage? He is in an unstable cardiac condition. That's the reason you need to do electrical cardioversion in order to manage that short bout of atrial fibrillation. 60-year-old with 10 years smoking history comes to gastroenterologist, and the CT findings have been shown to you. So what do you want to do in this given case? So basically there is a mass in the head of the pancreas. So she need to undergo the pancreaticoduodenectomy, which is the Whipple's procedure, is considered to be the most important step in the management. 40-year-olds brought to emergency in a motor vehicle crash, hemodynamically stable. Pelvic X-ray is typically showing the dislocation of the pelvis. A dislocated pelvis, until promptly treated, is at risk of developing a vascular necrosis, is what you need to remember. 48-year-old with the right upper quadrant pain with the fever, and she looked yellow in the morning, right upper quadrant, Murphy's sign is positive. Then a sonography is being done where you can see the presence of the stone. So classically obstruction of the cystic duct is the problem, and the patient is having cholangitis, which is triad of fever, right upper quadrant pain and jaundice because of the stasis and congestion in the biliary tract, is what you need to remember. 35-year-old with a history of myomectomy, left salpingo-oophorectomy, and the patient reports that she did not have a bowel movement or flatulence since the beginning of the abdominal pain, and her CT has her abdominal CT has been shown. So what is the main problem? So fundamentally there are intra-abdominal adhesions, post-operatively very common, that lead to development of the small bowel obstruction. Small bowel obstruction presents with abdominal distension, nausea, cramping, emesis, high-pitched bowel sounds, etc., etc. 24-year-old with bloody diarrhea happening intermittently every 6 hours. Colonoscopy has been done. And what do you see on colonoscopy, doctor? Colonoscopy is showing ulcerative colitis from the rectum and large intestine, and involvement is continuous but only limited to the mucosal layer. So how do you manage an active ulcerative colitis? What is your starting drug? So you need to use mesalazine in order to manage this case of ulcerative colitis. 40-year-old comes to emergency with 2 days of constant moderate abdominal pain, and her medical history is significant for a chronic pain syndrome for which she takes opiates regularly, and she does not have any rebound tenderness. and her CBP, urine analysis, basic metabolic rate were all unremarkable. And what do you see? Typically, what we are seeing is post-operatively the development of paralytic ileus. So, she is taking regular dosage of medication, typically opiates. It is not post-operative, but because of taking the opiates also, or hypokalemia, there are many reasons for the development of the paralytic ileus. 55-year-old complains of left flank pain with hematuria and a palpable abdominal mass. And typically you can see the presence of a renal cell carcinoma. Renal cell carcinoma, what is the treatment? Left radical nephrectomy is what you need to do here. Flank pain, hematuria, palpable mass. These are called the classical clinical presenting features of renal cell carcinoma. 42-year-old man, typically severe pelvic pain after a accident, and what you are seeing here is the radiograph. So the bulbous urethra got crushed. So there is an extravasation of the urine, and that typically happens into the anterior abdominal wall. So the rupture of urethra with the extravasation of urine is the topic of interest here. Now there is a worst headache, phonophobia, photophobia, blurred vision, CT of the head is typically showing the presence of intracranial hemorrhage and airway breathing circulation. So intubate the patient first. That's what needs to be done, especially when the Glasgow Coma scale is less than 8. 58-year-old, colicky abdominal pain, which is very severe. A contrast study has been done, and this is typically called the kidney bean appearance. So this kind of an appearance is a feature of cecal volvulus. And what is the management? Hemicolectomy is the only rescue for this given clinical condition of cecal volvulus. 38-year-old brought to emergency department, and he was given 2 liters of lactated ringer, and his BP is 108/76, and severe pain is there on pelvic compression, and blood is along the urethral meatus. Then what is the best investigation you want to do in order to evaluate this kind of a clinical scenario? It's a retrograde ureterogram that need to be done whenever there is any blood at urethral meatus. A rectal examination is used. What is the positive finding in urethral injury? A high riding ballotable prostrate. Whenever you do per rectal examination, if it is a high riding ballotable, prostrate is ballotable means urethral injury is there. And the most definitive test after the rectal examination when you are suspecting urethral injury is to do a ureterogram is what you need to understand.